Hello, I'm Enrique Vilar, consultant nephrologist from the Lister Hospital in Stevenage. I'm going to tell you about why I think a study called high-dose intravenous iron reduces myocardial infarction in patients on hemodialysis is of significant clinical importance. This is a UK study published in cardiovascular research by Mark Petrie, Ian McDougall and colleagues. And this study follows on as a post hoc analysis following the pivotal trial. The pivotal trial, you may be aware of, was a randomized control trial published in the New England Journal of Medicine, where patients in the UK across multiple centres were randomized to a regime of proactive or more aggressive intravenous iron versus a reactive lower dose intravenous iron regimen. In this post hoc analysis, the authors aim to determine whether a proactive intravenous iron regime was beneficial in reducing the rates of myocardial infarctions in the study population. The study found that fewer first fatal and non-fatal myocardial infarctions occurred in the higher dose group compared to the lower dose intravenous iron group, with rates of 3.5 compared to 4.9 events per 100 patient years, and that reached statistical significance. Additionally, in the time to first event analysis, the proactive high-dose intravenous iron regime was associated with a reduction in risk of non-fatal and fatal myocardial infarctions by a 31% margin compared to the low-dose regimen. So why is this an important study? Although it's a post hoc analysis, this study demonstrates that treatment with the proactive pivotal intravenous iron regime compared to the reactive regime was associated with a significant reduction in the risk of myocardial infarctions, both fatal and non-fatal, and also in the time to first event analysis. We don't have many clinical trials in patients on hemodialysis that have demonstrated reductions in the rates of cardiovascular events, and we know that cardiovascular events are common and a leading cause of mortality and morbidity in patients on hemodialysis. And this study supports the adoption of a pivotal type proactive iron regime as standard of care in patients on hemodialysis.